Hello everyone, I am Julian Morris with the Channel 5 News. In the headlines, Dominica National Lotteries donates over $60,000 in food hampers to vulnerable citizens. Training of shelter managers remains the focus as we get deeper into the hurricane season. And the WHO reports over 9 million cases of COVID-19 and over 470,000 deaths so far. The details coming up.
Helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
First up in the news, thousands of dollars of food items donated to the vulnerable community. The donation from Dominica National Lottery as they assisted those most severely impacted by the COVID-19 pandemic.
The past 3 months have been challenging for all of us as individuals and the corporate community alike. With changes in the job industry and economic climate, CBN, in the spirit of assisting the wider community, extends its corporate responsibility. Stepping out of our usual contribution to sports and culture, the Dominica National Lottery, through its agent base, will donate hampers in the amount of 68,000 EC dollars, aimed at cushioning the impact felt by vulnerable individuals within our community during the COVID-19 pandemic. Purchasing of supplies through the agent base is also meant as an additional form of support to those who sell our products.
During Friday's ceremony, items were distributed to individuals in Kings Hill, Newtown and Fortney, Silver Lake and Bath Estate, Gutter Village and Fokole, Tarish Pit, Rosa Central, and Goodwill and Pottersville. On behalf of the recipients, I just want to say thank you. I know we are in a very difficult time, and these packages will go a very long way. From them, through me, I want to say a heartfelt thank you to the Dominica Lotteries Commission and also the Roseau City Council who vetted the vulnerable people. So once again, thank you. Councillor in Ward 3 of the Roseau City Council explained how those who received packages were selected.
As a community worker, I have been on the ground for many years. And one of the things is that some people may look like they have things, but when you look at it, they may have loans, they may have different stuff that affecting their livelihood. But we try to get down to people, the people in the community that we for sure know that they are vulnerable and they need. For a matter of fact, we have been going through a lot of stuff. We've gone through the hurricane, and now look, we have this COVID-19. So definitely, and we're in touch with these people. Friday's ceremony marked the first in a series of distributions of 340 hampers to needy individuals island-wide. Training of shelter managers to get underway next week. Here's Andrea Louis with more.
That's according to Program Officer in the Office of Disaster Management, Malcolm Christian, as other trainings at the ODM have been halted due to the COVID-19 crisis. Dominica and the rest of the region are currently in the 2020 hurricane season, which has been forecast to be above average. Mr. Christian says the island-wide training of shelter managers is due to start on Monday and continue into July and August as a refresher course for existing managers and to meet the demand for new shelter managers.
We have an agenda through July and August where we'll be doing it on a district level. So we'll be concentrating, let's say for instance, the district of Granby. So Granby will be focusing from Bellevue, Tetmon, Bacatel, Bichlet and Granby. Throughout all the districts. And I want to highlight we'll be looking at the Kalinago territory as a district on its own. Okay, and within the Kalinago territory we have 8 shelters. So you can imagine the need for shelter managers to be trained.
The physical distancing guidelines put in place by the Ministry of Health will also impact functions at the shelter. Christian says the shelter managers will be following the most recent information and act accordingly.
There have been guidelines out as to how many people it has reached. We're hoping that it has reached. The information continues to spread, so some way, somehow, the people will get to know. But for sure, we are in the new training, we are going to be talking about those guidelines. There's always need for more shelter managers. Some people, after probably when they get into it, they realize how challenging it is, and sometimes that can break them down. So, you try and encourage them and so on. But nonetheless, there are other persons that show interest. So, the more the merrier. You do what you can to train them. So in the time that you need, then they are available, they are trained, so they can carry out the duty.
The training will also include an emergency radio communication program. Andrea Louis, Channel 5 News.
Further delays towards getting full compliance with Dominica's fresh produce legislation. We go again to Andrea Louis for more.
The fresh produce legislation deals primarily with the production of commodities and ensuring local produce meets global market standards. General Secretary of the Dominica Hucksters Association, Cecil Joseph, says work on following the guidelines under that document began years ago, but there is still more to be done.
We are working on it. We are working, all agencies involved. We thought it would be easy to just sign it and get it off. But there's much more needed. To put in legislation, you have to have the resources. You need to, if you say, well, that produce has to be prepared in a certain manner, a piece of legislation doesn't get it done. You have to have things on the ground. You need to have the allied services, the support services, to ensure that it's being done in a situation in which we have people moving away from agriculture in Dominica. Elderly people are there, but new young people are getting in. And we are thankful for the Haitians who are there, but they are there today and they're not there tomorrow.
The Fresh Produce Act makes provisions to ensure farmers engage in good agricultural practices, which will give Dominican produce a leg up in the international community.
In principle, it deals with the production that commodities has to be prepared, has to be grown under certain conditions, like how we used to do bananas before. You don't just put chemicals and things like that at any way you want. There are a number of countries who want to be sure that that your soil is tested. They want to be sure, for example, in terms of things like cocoa beans, but things like cadmium, which is in the soil, the level must not be too high. So this is one factor. Secondly, there's the sanitation aspect, that the fields have to have a certain level of sanitation. You don't just do anything anywhere. In the fields, you must have proper toilets, proper sanitary facilities. Then when it comes to the pesticide and chemicals that you are using, it has to be stored properly, and you have to keep records.
Mr. Joseph pointed out that the aging farmers and reluctance of youth to get involved in the industry are setbacks to moving forward with the legislation.
Work has started quite a number of years ago. It has started, but the challenge is the older farmers are going to heaven, and the younger ones are not coming in that quickly. And so you almost have to be doing it over and over. Even here with a number of the hucksters, the elderly ones are going, so we have to be doing the whole exercise again with the younger ones. So it's an ongoing thing.
As of Thursday, 25th June 2020, the number of active COVID-19 cases in Dominica remained at 0. Total confirmed cases 18, with the same number recovered. To date, no COVID-19 related deaths have been recorded in Dominica. 781 people were tested with 763 negative results. All 152 contacts identified have been cleared. Currently, there are 0 contacts under investigation and 41 in government quarantine. But there is a completely different picture in neighboring Antigua and Barbuda. The number of confirmed cases of COVID-19 in that country jumped to 65 this week after 39 imported cases were reported there. The numbers jumped after the individuals arrived in Antigua last Friday and Saturday. Out of 109 samples sent to CAFA, 39 were positive for COVID-19. The 39 new cases, who are all in isolation, include 19 nationals repatriated from the Dominican Republic. The other 20 are a mixture of nationals and tourists who arrived from the United States. You are watching Channel 5 News. We'll have more after this.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD. All for $160 a month with the new all-in bundle. With Flow, it only gets better.
Thank you for staying with us. More than 9.1 million cases of COVID-19 have been reported to the World Health Organization. Director General of the World Health Organization, Dr. Tedros Ghebreyesus, said on Wednesday, out of that number, more than 470,000 people have died.
In the first month of this outbreak, less than 10,000 cases were reported to WHO. In the last month, almost 4 million cases have been reported. We expect to reach a total of 10 million cases within the next week. This is a sober reminder that even as we continue research into vaccines and therapeutics, we have an urgent responsibility to do everything we can with the tools we have now to suppress transmission and save lives. One of the most effective ways of saving lives is providing oxygen to patients who need it. Several news reports published today have highlighted the vital role of oxygen in treating patients with severe and critical COVID-19. This has been an area of intense focus for WHO since the beginning of the pandemic. Patients with severe and critical COVID-19 cannot get enough oxygen into their blood by breathing normally. They need higher concentrations of oxygen and support to get it into their lungs. Left untreated, severe COVID-19 deprives cells and organs of the oxygen they need, which ultimately leads to organ failure and death.
WHO estimates that at the current rate of about 1 million new cases a week, the world needs about 620,000 cubic meters of oxygen a day. That's about 88,000 large cylinders.
Many countries are now experiencing difficulties in obtaining oxygen concentrators. 80% of the market is owned by just few companies, and demand is currently outstripping supply. WHO and the UN partners are working with manufacturers across the world through a variety of private sector networks to buy oxygen concentrators for countries that need them most. Ongoing talks with suppliers in recent weeks have enabled WHO to buy 14,000 oxygen concentrators, which will be sent to 120 countries in the coming weeks. WHO has identified a further 170,000 concentrators that can be available over the next 6 months with a value of $100 million. In addition, WHO has bought 9,800 pulse oximeters, a simple device used to monitor oxygen in patients' blood, which are being prepared for shipment. Another challenge is that many patients with critical disease need a higher flow rate of oxygen than is produced by most commercially available concentrators. To address this challenge, WHO is supporting several countries to buy equipment that will enable them to generate their own concentrated oxygen in larger amounts.
The Tedros believes this is a sustainable solution for COVID-19 but requires technical expertise for maintenance. And as some countries begin to reopen societies and economies shut down by COVID-19, the WHO says questions as to how to hold large gatherings of people and do so safely are becoming increasingly important. The government of the Kingdom of Saudi Arabia announced earlier this week this year's Hajj, the pilgrimage to Mecca, will proceed with a limited number of pilgrims of different nationalities who live within the kingdom.
This decision was made based on a risk assessment and analysis of different scenarios in accordance with WHO's guidance to protect the safety of pilgrims and minimize the risk of transmission. WHO supports this decision. We understand that it was not an easy decision to make, and we also understand it is a major disappointment for many Muslims who are looking forward to making their pilgrimage this year. This is another example of the hard choices that all countries must make to put health first.
But how do countries avoid further lockdowns as many, including Dominica, seek to reopen their borders shut down for months now due to COVID-19?
There needs to be a very sustained investment in public health infrastructure and the capacity to isolate or test and trace and isolate, and capacity to quarantine contacts. It is very difficult to take the sting out of this pandemic or out of this epidemic in the country unless you're able to successfully isolate cases and quarantine contacts. In the absence of a capacity to do that, then the spectre of further lockdowns cannot be excluded. And really, I don't think anybody wants to go back to population-wide, society-wide lockdowns, but the only way in some circumstances to avoid that now is a very, very, very aggressive investment in our capacity to detect cases, confirm cases, quarantine contacts, and keep our communities on board and willing, able, without coercion, to support clear messaging and clear instructions and requests from government in a trusting environment. I can't stress that enough.
And a serious loss to the legal profession in Dominica. That's how President of the Dominica Bar Association, Heather Felix Evans, has described the passing of Magistrate Mikey Bruni this week. The DBA president acknowledged that the association has lost quite a few members in recent times, and that has dealt a major blow to the expertise within the profession.
Yes, the Bar Association, or the Dominica Bar, has suffered a quick succession of losses in terms of human life, in terms of lawyers, and all of them really have been very active in the profession, well liked, well respected. The loss of each of them is significant to the profession. So cumulatively, it's huge. And we as lawyers do have to take care of ourselves. We have to take care of our families, but we have to take care of our health. Because while we're on earth, the quality of our life has to be good. You understand? And yes, you work hard, you play hard.
It's not lost on the DBA president that some of these colleagues, including Michael Bruni, died from cancer.
Oh yes, you have to maintain a balance. I mean, it cannot be about just law, work. Or there will be times, of course, when the work, the pressure is on. So it's like it ebbs and it flows, You know, it's like hills and valleys. And so when you do get a break, you need to take a break. But the demands are still there. Your clients expect you to produce. The only time your clients tell you take it easy is when you finish them, when you finish your work. But so long as you have work doing for them, they're not telling you take it easy. It's only when you finish your thing, take it easy, go and rest. But it is our responsibility to take care of ourselves. You must exercise, you must eat well. You know, these are things I try to practice. You have a family life, you know, and you cannot cut off friends. one cannot cut off their friends. Friendships and friends are very important, but friends, there's a time and a place for everything.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
To end the news, a look again at the headlines. Dominica National Lotteries donates over $60,000 in food hampers to vulnerable communities or citizens. Training of shelter managers remains the focus as we get deeper into the hurricane season. And the WHO reports over 9 million cases of COVID-19 and over 470,000 deaths so far. You may access the news on our YouTube channel. On behalf of the production team, I am Julian Morris. Thank you for watching. Have a good weekend.